Good morning, everyone, and you're very welcome along to this EU SHAFE meeting with a focus on social participation. We're bringing you this morning's event from County Louth in Ireland. The sun is shining, and let me tell you, that doesn't happen too often in Ireland. So it's unfortunate you can't be with us here in person this morning. My name is Sinead Hussey, and I'm the moderator of this morning's session. I'd like to welcome you all online today. We would love to have you here, but unfortunately we can't. But of course, we are going to have some very good and interesting conversations. I'd like to welcome all our MEPs, our TDs, our senators and councillors, and our age-friendly advocates. And of course, a Céad Míle Fáilte to all our European partners and friends this morning. You'll see from the agenda, we have a very busy morning ahead. So to get the event underway, I'd like to introduce Joan Martin. She's the CEO of Louth County Council and the President of the Covenant of Demographic Change.
Thanks very much, Sinead, and good morning to everybody. And as Sinead said, a huge welcome to County Louth and to Ireland for those who don't live here. I suppose when I look back at the start of this project, which is probably about a little bit more than 18 months ago, we visited Aarhus in Denmark for the kick-off meeting, as we call it. And we were so excited, looking forward to this event and to welcoming everybody to Ireland, and really, really disappointed that we're not able to welcome you in person. But we're where we are, and it's been a very challenging time for us, I suppose, since that meeting. And little did we dream of I suppose, the huge challenges we would face just as individuals, as countries, and the huge challenges that COVID and the need for isolation and shielding would present, particularly to our older people. But then the huge opportunities that are presented to us in learning and in testing and in innovating and all of those things. So there's good and bad in everything, as they say. So I suppose Louth was Ireland's first age-friendly county. And it's wonderful that Ireland, the entirety of Ireland, is now an age-friendly country. But we've been involved in age-friendly now for about 12 years, and gone over and back to Europe and involved in various initiatives that were going on. And I suppose it always struck me that a lot of the age-friendly environment work, the work that we were doing here in Louth and in Ireland, was very much bottom-up. It was being led and driven by councils and voluntary groups and local organisations, working very much to the WHO model of age-friendly cities and communities, but it was driven from a local level. And when I went to conferences in Europe, I was always very struck by when they talked about the challenge of ageing and the challenge of demographic change and the changing demographic of our population. It was talked about in a slightly negative way, and a big emphasis on the cost of it and of trying to prevent ill health and stuff like that, whereas our programme was always about a more positive approach, I suppose, and in trying to make our houses, our places, our communities, our country, the very best place for people to be able to grow old in. So when I heard about this particular project and had the opportunity to join it, I saw it as a great opportunity for yet more learning, as we always do in European projects. This exchange of information is so enriching and so useful, but it also offered us an opportunity to have an input and to suddenly get involved in policy development at a regional level. In our own case, in the ERDF programme at a regional level in Ireland, but at a national level and at an international level. And we've seen that with papers being prepared and submitted now to the Green Paper on Ageing, to the National Development Plan process here in Ireland. So we're continuing to learn, continuing to develop our own knowledge and our future in age-friendly environments. But we're also now seeking actively and succeeding in influencing policy. And that's very important, that policy is not just looking at the cost and the negative impact, but is also looking at the need to improve people's living environments and streets and so on, so that we can all live richer lives in our communities for as long as humanly possible. So I'm here now today. Some of the stuff I'll have heard before and some I won't. And I'm really excited and looking forward to the exchange of learning. And I'll talk to you again later on. I'll be joining the panel at the end of the morning. So again, huge welcome. Thanks so much for joining us. And I hope that you get a huge amount of learning and encouragement and motivation from what you'll hear over the course of this morning. So back to you, Sinead. Thanks very much.
Thank you, Joan. So now we're going to move to our first speaker today. Suzanne Smith is the Centre Manager of Netwell Casala at Dundalk Institute of Technology. She's carried out an assessment of Ireland's good practice, looking at the initiative Drogheda and district support for older people. So first, we're going to take a look at what they do.
Hi, this is the Drogheda and District Support for Older People. We started in 2011 with absolutely nothing. Today we have 6 major things which we do, and we've just launched another very exciting one in the last few weeks. Our care and repair service, we do maintenance on older people's houses and gardens.
The lads really enjoy it because they are super volunteers.
I just want to say how happy I am to have the feeling of security that these people give me. It's very good when you're living on your own and you're my age.
We have a befriending situation where we actually spend at least an hour with an old person in their home.
I think it's very important that we remember that older people sometimes don't have family, no contact. It's very difficult for them because they're isolated.
It made a great difference to have somebody that genuinely wanted to discuss with me my interests, and even find that perhaps we had a lot in common.
We organise volunteers to visit older people in their homes. We assess, guard a vet and train our volunteers so that they are best equipped to deal with loneliness and people isolated in their homes.
We have the Good Morning Drogheda phone service where we phone up about 80 people every morning to make sure they're all safe and well.
Hello.
Morning, good morning.
Drogheda and district support, I find are great. They really give me a sense of not being on my own.
I run the distribution centre here. We dispense incontinence wear, usually for the elderly, but for some children as well. This originally was done with the HSC. They were in the Haymarket, and when they moved, they asked for charity to look after this, and we took it on. 99.9% of the people who come in here love us to bits.
South Louth Primary Care Services are more than happy with the engagement we have with Drogheda and District Support for Older People. Recently, with regard to the provision of incontinence wear in a distribution centre in Green Hills, that has been a tremendous sort of piece of work.
In the office here in the Haymarket, we try to do everything we can to help anybody who might come in for any reason whatsoever.
I work here in the Cottage Hospital. It's a transitional care unit it's a short stay unit where we take clients over from the Lourdes Hospital. These are older people who are not yet ready to go home or they're waiting a home care package or aids and appliances. Drogheda and district support services have been an invaluable asset to me and my discharge planning and getting people home safely.
Well, Drogheda and district support for older people mainly deal with older people, and similarly here in Trader Lodge, a lot of our clients would be on the older scale. So we became associates and friends, I like to think, over the last number of years. We like to help each other out, and in many respects, people might pop into Dave and his team in the office below and look for help, and David often give us a phone call to say, if somebody here going through dementia, or they think they might have early stages of dementia and they want advice, and he'd pass on phone numbers.
Our most recent addition is the Trishaw, where we'll be able to take people who live in nursing homes for a spin or a trip in a bicycle along the River Boyne.
From Louth Volunteer Centre's perspective, we absolutely love working with Drogheda District Support for Older People. We actually hold them up as best practice in volunteer management, because when we refer volunteers, they always get back.
They can represent the voice of older people in the decision-making process because they know what older people need through their services. Drogheda District Support is a go-to centre for me to find out what are the issues that older people experience when we are developing policy in Louth County Council.
And that just gives you an insight into some of the great things being done by Drogheda and District Support for Older People. And now we're joined by Suzanne Smith. As I said, she's the Centre Manager of Medical Casala at Dundalk Institute of Technology. And Suzanne has carried out an assessment of this project and will give us her findings now.
Céad Míle Fáilte, welcome to the conference from sunny Drogheda. Today I'm presenting a service evaluation of Drogheda and District Support for Older People. In conducting the analysis, a range of data sources and evaluation frameworks were used, and a thematic analysis was conducted on the data. Today's presentation is going to focus on the personal impact and outcomes, and the more broad impact and outcomes of the service are addressed in the written report. So to give you a little bit of context, Drogheda District Support for Older People was established in 2011 by a small group of volunteers led by Dave Turner. That small group has now turned into 120 volunteers, so it's an entirely volunteer-led and run organisation with only 2 paid employees, a part-time volunteer coordinator and a part-time receptionist. The operational decisions for the organisation are made by a committee of 13 working, or rather volunteering members. So all members of the committee are very actively involved in the provision of the services as volunteers. Most of the fundraising for Drogheda District comes from a grant from the Health Service Executive. That's an annual grant. It's competitive, so it's not guaranteed, and it's also capped. So it doesn't matter how wide the breadth of services are that are offered by the organisation, there's a cap on what's available in terms of that grant for funding. Local fundraising then has a dual purpose of not only collecting some funds, but also increasing awareness within the community of Drogheda District Support for Older People, and allowing them also an opportunity to engage with other organisations in the community and to support other organisations. So the stated purpose of Drogheda District Support for Older People is to provide support for the health, safety and well-being of older people through community involvement, essentially through volunteering. And when I talked to the team and asked them to unpack this a little bit, we explored what they meant by this and what it essentially would look like. And 2 things emerged. They identified that this is about finding ways to support older people to be more comfortable in their lives. So it's about quality of life and offering opportunities through volunteering to help people feel like they're still people, not just older people. So this is a central piece in terms of the ethos of this organisation. And as you'll see, as I talk a little bit about what they do and how they do it, you will see that this is reflected throughout everything they do, and it's also reflected in the impact that they have on people. Fundamentally, Drogheda District Support is about seeing needs and filling needs. In the 1940s, Maslow proposed a list of human needs that could be grouped, organised and prioritised into a hierarchy on the basis that some needs must be met before others. Those at the bottom of the pyramid need to be met before those higher up. As more people are living longer and healthier lives, however, it's accepted that we cycle through Maslow's categories. But meeting these needs as they arise at different stages of life is essential to having a healthy and fulfilling life. Drogheda District Support offer a wide variety of activities and services, and I've organised them into 4 pillars here. And each pillar represents 2 of Maslow's hierarchy categories of needs. So the practical security, the activities that fall under that pillar cover the physical or basic and safety needs that Maslow identified. The activities under the personal support pillar address the safety and love and belonging needs. The social connection pillar address the love, belonging and esteem needs. And then the legacy growth pillar address basically the belonging, esteem and self-actualization needs. I just wanted to note that the term legacy is particularly relevant, I think, when it comes to older people. And it's one of the things that we see in our research, that older people often want to leave some kind of substantial legacy behind. You know, the volunteering opportunity that Drogheda District Support provides actually provides people with an opportunity to do that, as well as the opportunities that the services and activities provide for growth and for people to kind of live their best life and be their best selves.
So a lot of people will start at the office, and this is where you can make a telephone call with an inquiry or stop by. You can come in, have a cup of tea and a chat, or just drop in with a query or a question. And one of the things the office does is it kind of fills in gaps between other services that are available or what other organisations in the area offer. And what people said was it's a one-stop shop. You basically come into the office and anything you need, you can get there. I'm going to talk a little bit about the different services that are on offer within Drogheda District Support. So you may get a referral to one of those services, or you may be referred on to another organisation if Drogheda District can't address the need. And one of the things people said fairly frequently was, where else would I go? Where else could I go to kind of get all the information that I need and get whatever referrals I need in one place? And then again, another theme was around nothing is too much trouble, no matter what you need or want. And older people are generally concerned about being a burden or a bother. So it's really, it really says something about how the ethos of the organisation is represented in real practice, that people felt that it's never a bother to just come in and find out what you need and get what you need from the office.
Another concern for older people is sometimes feeling safe or secure about letting people into their homes. And this applies also to if you need some work done, if you need a plumber or an electrician, how do you find someone you trust and someone you would trust to let into your home? So Drogheda District Support has a list of trusted traders, so people can phone up and they can get the name of a trader who they can contact then to come out to them. And for smaller jobs, they have a care and repair team of about 10 volunteers who do great work around the town, and they'll go out and they'll change a light bulb, or they'll cut grass, or do a bit of painting, or take things to the recycling centre. Pretty much any kind of odd job. And one of the things that people said was, I'd feel safe and secure in contacting them. And I, could be put in touch with someone trustworthy who I wouldn't mind having in my house. So again, you can see how they're helping to meet those basic needs and those safety security needs for people in the community. And the care and repair team will go out, as I said, and do all kinds of jobs, including they get referrals from the public health nurses and the occupational therapists to go out and install grab rails for people. But if you just need a light bulb change, they will go out and do that. And something somebody said really struck me, in that it's wonderful to know there's someone willing to come and change a light bulb who wouldn't think less of you because you can't do it yourself. And I think that's also more than just respecting people's dignity. But if people feel that their dignity is respected and that they're not looked down on or maybe looked at in a paternalistic way because they're no longer able to do something that used to be any bother to them before, that also encourages people to have a sense of personal safety and personal autonomy and independence. And all of those things are important as we get older because they're also important for someone to be able to feel like they can make the next phone call if they need another job done, if they're going to be treated with this kind of respect and dignity when someone comes to do what might feel like or seem like a small job. The entirely volunteer-run distribution centre coordinates the distribution of continence supplies to people in Drogheda and the surrounding area. But it does a little bit more than that, in that there's a location within the warehouse where you can come and sit down and have a cup of tea and a chat, and you can, through that avenue, access the other activities and service and get referrals and so on to the other things that the organisation does. So again, you know, lots of different pathways in through the different services to other services that are offered. And I suppose that's also a reflection of one of the things that people said, is that you never feel like you're a bother and nothing is too much trouble. And an example of this for the distribution centre team was last year, when many people were cocooning and were unable to come out and collect their continents, where the team of volunteers just delivered them. It wasn't a big deal. It was something that people looked like they probably needed, and the response of the volunteers was, we'll just deliver it. And it's that responsiveness to needs that sometimes are not even loudly articulated by people, that is one of the pieces of the secret sauce. It's the, you know, it's one of the things that are special and important, and really make this organisation stand out among others. The befriending and good morning call service, again, address belonging and security needs. Volunteers will call up to 5 days a week to just check in as part of the good morning calls, or they have up to 48 pairs of befriending matches. Now, those are on hold at the moment due to COVID, but hopefully will resume fairly soon. And some of the things that people said about these services were, I just felt so vulnerable after my husband died. You've no idea what that call means to me. And one of the gentlemen I spoke to said, you know, they make older people feel wanted, and it makes you feel like you have an extended family. So you can see how these services address not only those security needs, but also those belonging needs that are so important to all of us at different stages in our life, and particularly when we may have times when we feel vulnerable and we need support and encouragement from other people. There are lots of opportunities for social connection, so and as well as that for, you know, developing self-esteem and new skills and so on. So you know, whether that be classes or whether it be outings and activities, these services are also offered to address these needs. A nice service that's offered is the trishaws. Primarily, it's people from nursing homes who get an opportunity to use the trishaws, and this also helps those people in nursing homes to feel like they're part of the community, and to actually not just feel as part of the community, but to be part of the wider community. And so again, this is addressing belonging needs that sometimes people don't even acknowledge or realize or notice that they have. So it's about, you know, bringing people in and ensuring that people belong and feel that they belong as part of the community. The final pillar we talked about was growth and legacy. And so, again, as I mentioned, classes offer an opportunity for growth, whether that's learning new skills or whether it's passing on skills. And so one of the projects that they do is the Fáilte Isteach, where volunteers teach new immigrants to Ireland, teach English through conversation. And in addition to leaving that legacy of passing on, you know, those English language skills, there's also a contribution being made there to the change and the social change in the local community. And that is also a part of that, meeting that need to leave a legacy that's achieved through the services of Drogheda District Support. Referrals to the service come from a variety of different sources. One example is where the occupational therapists and the public health nurses now automatically, when they provide grab rails or recommend a grab rail or a handrail is installed in someone's home, they automatically provide a referral to Drogheda District Support for the care and repair team to go in and install that grab rail. Because what was happening was people were being provided with these resources, but then they had nobody to put them in. Another key referral source actually is volunteers who are on the ground and can see where the need is. So this means that a job to, fix a grab rail could result in a referral for a good morning call, or a distribution centre delivery might result in a referral to care and repair to cut someone's grass, or a befriending call might result in a referral to the office for help filling out a pension claim form. So it's all connected, and it's focused on identifying needs and filling them kind of one person at a time. When conducting an evaluation, we're often kind of geared towards trying to find ways to measure and quantify all of these things: inputs, outputs, impacts, and so on. And on some level, sometimes it's easy to quantify the outputs. And sometimes we can quantify the inputs as well, such as, number of volunteers and hours worked. But I think it's also important, actually, in an organisation like this, to reckon on and to evaluate and to consider those non-quantifiable, those qualitative inputs, like having a leadership that's responsive and that's brave, courageous and creative enough to be able to identify when there are needs and how to apply creative solutions to meeting those needs, so that those kinds of inputs are much more difficult to put a quantity on or to put a measurement on, but they are extremely important in an organisation like this that needs to find creative ways to quickly address needs that it identifies in order to have a significant impact. Likewise, when we look at activities, I've just discussed a lot of the activities, but things like the activities where the volunteers are helping out other organisations with their events. That's not only an activity, but on some level it's also an input, because it means that they're also gaining, community awareness for the organisation, and they're also extending their reach into other organisations to identify people who might need and use their services. So it's important to look at not only the measurable outputs, but also the more qualitative ones when we're evaluating. The outcomes and impacts are addressed in more detail in the report, and I've already addressed some, but I just want to point out one. Because the volunteers are very much on the ground and they offer a wide range of activities and services, this organisation, Drogheda District Support for Older People, is in a really good position to identify the needs of older people in the community and to feed that information back up to decision makers and policy makers, partly because of the strength of their relationships with the likes of the HSE and Louth County Council, so essentially the statutory bodies and the organisations and the groups that they're involved in. So that's maybe not an intentional part of their plan or their ethos, but it's a role that they now find themselves in a position to fill, and it's one that is offering voice and ensuring that older people in Drogheda and in that community have voice and have the ear, if you like, of policymakers in the area. In terms of the health and social care service impact or outcomes, rather than doing a cost-benefit analysis per se, which is a bit difficult in terms of we don't really have a whole lot of data that would enable that kind of analysis. I just want to point out a couple of things. I spoke with the head of primary care services, who told me that people used to call him crying with distress, and the misery that Drogheda District Support have eliminated by the distribution and safe supply of continence wear is immeasurable. From the data also, I found that they installed 150 grab rails in the past 3 years. And if we think that a hip replacement surgery costs approximately €14,000, and if each grab rail represents a saved hip replacement surgery, then that's approximately €2 million in savings from hip replacement surgeries that we might assume have not been done. Now, that might not be a fully accurate figure, but it's an interesting figure to play with for the moment anyway. And something else that I was told by the head of Older People Services was that Drogheda District Support has a huge impact on their ability to facilitate people from Drogheda returning home from hospital, and that they've made the critical difference to the discharge process. And the reason for that is now, when older people are being prepared to return home from hospital, Drogheda District Support will go in and they'll install grab rails, they'll link them up with a good morning call and maybe a befriender once they come home, and they'll check on them and make sure that their needs are met, and that enables the discharge process and for people to come home in Drogheda from hospital much quicker than they otherwise would. So that's not an insignificant impact, even though it's difficult to put a number on it and to quantify it. In considering important factors for replicating or transferring the model of Drogheda District Support for Older People, 6 key things came out of the analysis. And most of them won't be a surprise. Leadership is always important in terms of an organisation, as is the ethos. And in this case, I think the fact that Drogheda District Support have a very clear, simple ethos, that they haven't changed since they started. It's sustained, and that their leadership and their ethos kind of operate hand in hand. And that instead of kind of expanding and changing their original intention or their ethos, what they have done is they have simply found creative and new ways to respond to the needs that they see in the community in ways that are consistent with their ethos. So those 2 things go hand in hand and are quite important. The relationships are really important. Obviously, volunteers are the focus of the organisation, so relationships with volunteers are essential. I mean, this organisation not only couldn't exist without volunteers, but they exist for volunteers. So volunteers always have to be at the centre, but relationships with statutory bodies and with key decision makers in the community are also really essential to enabling Drogheda District Support to function as effectively as it does in the local community. A stable funding stream would be essential if this model was to be replicated elsewhere. But the 6th item that I have here is local, is one that came up with a number of people, and this is this idea that that this service or this organisation is about local people supporting local people and identifying local needs and finding local solutions. So that whole local element is really essential. And you know, a lot of the people I spoke to kind of raised the question of how effective it would be if it was an organisation that came in from the outside trying to essentially create these services and activities. And there were serious questions among the people I spoke to about how feasible that would be, or whether it would be as successful. So these would be the 6 themes that have come out of the analysis in terms of what would be important to consider in terms of replicating or transferring the Drogheda District Support for Older People model to another location. Finally, I would like to leave you with just a couple of quotes that I think sum it up in terms of the impact that the Drogheda District Support for Older People have in the community and why they have been identified as an exemplar service. And so someone said, you know, they're so approachable, nothing's too much trouble, and they treat you like a normal being, a normal human being, not like an old lady. And every day is different. You never know when you come into the office. A volunteer told me what you'll be doing that day. And it gives me a reason to get out of bed every day. And I think those sum up what people think about and feel about Drogheda District Support for Older People. And I think indicate very clearly that they are having the desired effect, at least the effect that they wish to have in their local community. So I thank you very much. I hope I've given you some sense of the impact that Drogheda District Support have on people like you and I, on our parents and grandparents. And I thank you very much for your attention, and I hope you enjoy the rest of the conference.
Thank you so much, Suzanne. That was really interesting. And that quote there at the end, you know, it gives me a reason to get out of bed every day. I mean, it's really, really striking how, you know, a voluntary group like this can make such a significant difference. And I suppose, Suzanne, in the last 12 months to 15 months, you know, it has really come into its own.
It certainly has, Sinead. And I was just speaking with Dave actually this week, and he said, like, they're making 165 calls a day now to people in the community. I mean, that has really escalated, and it has become really, really important service for local people in Drogheda, and we're delighted to have them.
I suppose, yeah, people in Drogheda are, you know, are very lucky to have a service like this, but, you know, there's no reason why this couldn't be rolled out in anywhere else. But as you said, it needs, you know, that local buy-in, it needs the volunteerism there.
Absolutely. And, you know, I'm sure that it's not just an Irish thing, or certainly not, it's not just a Drogheda thing or an Irish thing, you know, that we like to know who we are, and the people from across the river are a different breed altogether. So, but that idea that people coming from their own local community, who know the kind of the local setup, who know the people to talk to, who know the local needs, and who know where to get the problems solved. I think that that's certainly feasible anywhere in the world. It's just a question of, I suppose, having all of that right mix of the right leadership, the right ethos, and really a good solid focus on, I suppose, keeping it simple to some degree. Even though they do an awful lot of things, they keep it very simple. It's really about that respect and dignity for people, and not treating people like little old people. That really struck me.
Yeah, and as you said, that befriending service, like it's something as simple as picking up the phone and just having some contact, because, you know, people can, and I know myself from my own work as a journalist, especially when people were cocooning during COVID, you know, people had gone days without getting a phone call, without having any human contact.
Absolutely. And I think one of the things to remember for this organization as well, struck me, is that this is a group of older volunteers who are making those phone calls to older people in the community. And so that has also been challenging. It's been challenging for those volunteers because they are also having to cocoon and are facing the same restrictions and the same challenges. So the fact that they have been able to maintain what they do and provide such a broad range of services to such a wide range of people through older volunteers doing all that work is really something amazing, I think.
And Suzanne, if people want to have a look at that evaluation, we have the link in the chat so that people can go in and have a look at your presentation today.
Yes, and we also are putting that up on our website, so that would be netwellcasala.org, and I'm trying to get a recording of the presentation available as well, so just trying to deal with the tech on that, but absolutely, and people can contact me through Netwell Casala as well if they have any questions.
Brilliant, great, Suzanne. Listen, thank you so much for your contribution. And of course, this seminar this morning is being recorded, so if people want to look back at this particular segment, they can. If you do have any questions about anything, you can just pop them into the chat. We'll address them at some point, either before or after the panel session. So thank you, Suzanne, for your time this morning. And we'll move on to the next part, where we're going to look at some of Ireland's projects which show how technology is being used here to advance social participation. And the projects you'll see are Acorn, Alone, Super Connectors, Shafe, and Isaac.
The digital divide has always been a reality, but its ongoing impact was brought into stark relief by the pandemic.
When we paused the face-to-face programs, we realised quite quickly when we tried to get those participants online that the majority of them did not have a device, did not have any internet.
Digital poverty is hitting a lot of people across this country, and the biggest challenge would be to break down the barriers of the fear of turning on a computer.
Particularly like the older generation, I suppose for 5 or 6 months we're told don't go out of your home, you know, stuff like that.
It's a bit like the old thing of the 18th and 19th century where we had to combat illiteracy. We now have to combat digital illiteracy.
The world is technological now. Everything is technology. It's no longer a choice. It's not recreational. It's an essential.
Organisations now had to reimagine and adapt if they were going to reach the isolated and disadvantaged within the communities.
The nature of engagement across all public services has very much changed in terms of it is through online facilities, online platforms.
There is a digital group which came as part of the COVID response, working to try and upskill and make people digitally literate.
The technology companies need to reach out to older people to make their products accessible, reliable, engaging for older people. They need to understand that older folk approach things in a different way.
Quite often, the people who benefit best from our programs are those who are struggling. So they didn't have the confidence to use a device. So we needed a very, very easy to use device.
At Acorn, we'd long since recognised that age-friendly design was required to bridge the gap, and had created an easy-to-use, highly accessible smart tablet.
The design of them
which involved older people, consulted with older people, I think was great, because it meant you started out from a good space.
The way you can change it around is nice, and I suppose working with somebody on a one-to-one, you can set it up for their preferences. I think that's great.
The Acorn, it makes it simpler because there's less options and less things can go wrong.
What we found really good with the Acorn was the mobile data was inbuilt, so you didn't have this thing where you turn on the tablet and it wasn't working, and it can lead to frustration, so we found that really, really beneficial.
This smart tablet became the conduit for the delivery of innovative, inspiring, effective online programs that reconnected people and communities.
The difference that's made to our service users, to our residents, is that they've been able to contact their families and the families have been able to contact them. That was primarily so they were able to have like FaceTime.
We've had a participant on the programme that couldn't read or write, so we were able to get her up on the programme by speaking to her over the phone, by giving her the colour codes of the different options. This was online by using the Acorn device.
This way has allowed us to connect to people who had already left groups because they felt unsafe at night or a disability. And now they're able to link in from their own sitting room.
We have developed an age-friendly calendar of activities, so again that will promote content, whether that's from Bealtaine, the libraries are hosting events, the arts, cultural events, whatever events that are tailored towards an older adult in Tipperary can be showcased and promoted through directly as a device and a link onto your Acorn device.
We've had people go on programmes who haven't spoken to anybody, to a person, for days, and the delight on their face when they come on Zoom and see other people is actually quite magic, to be honest.
Thank you to the organisations and communities who continuously strive to make a difference for all of us. We at Acorn are dedicated to developing solutions which promote social inclusion, health and well-being for all.
What Acorn has done has opened the door for people to use tablets in their own home.
I know of a singing group online, social group online, and that's just literally meeting to have a chat.
They have their knitting group online, they have a gardening session online, we have chair yoga going on, we've cookery classes lined up as well.
You're bestowing a value on people by saying, of course you can have technology, you can, why not? And then for them to experience success in using it.
People who are in their 70s, 80s and 90s now, I think if they can be given the confidence to know that they can mess with this technology and learn through play, which is perhaps a novel concept for them, but that then you can open up a whole world.
The world has come into them and they are out in the world through this little tablet. Yeah.
Alone is a national organisation that supports and empowers older people to age safely and securely in their own homes. Alone provides an integrated system of support coordination, practical supports, befriending, a variety of phone services, social prescribing, housing with support and assistive technology. We use individualised support plans, provide a point of contact for access to help, financial benefits and supports, social care, housing, transport and other arising needs using technology and other services. Alone has developed a national infrastructure model which consists of a range of Alone service hubs. We are focused on delivering services through a collective of healthcare providers, community services, local authorities, age-friendly alliances, approved housing bodies and social enterprises, all working together, in turn avoiding duplication and streamlining services for older people. Alone's technology platform integrates family, community and medical professionals in older people's care. Our technology has focused on preventative interventions, which addresses key indicators such as frailty and resilience. Support coordinators and technology engagement officers identify technology that is suitable for an individual older person's needs and provides training to them. This ranges from safety and security, e-health, internet access, entertainment, reminders, and daily living skills. The Louth Healthy Ireland project demonstrates how the use of existing technologies in an innovative way can change how people manage their health and well-being, increase their confidence and resilience, delay a decline in their health status, and increase communication to loved ones. To demonstrate our work in social participation, we will meet two participants from our Healthy Ireland project in Louth, Ireland's first age-friendly county.
I'm Patricia Wright, and I'm 98 years of age. The physiotherapist phoned me and told me about a loan and suggested it might be something I would be interested in. They've given me a tablet, and even more important, they've given me Alexa, which is very good to have in the house. Brilliant. I get a lot of pleasure out of that. They haven't just given it to me, they have sent somebody down with this tablet, and they help me enormously. And I know that if I want anything particularly, that someone from a loan will come and help me. I could see my daughter, and I could talk to her almost face to face. And for my children, I found that wonderful, so I'm very grateful to a loan for helping me with this. I think it's wonderful, that. Yeah. It's company, to be honest.
My name's Noel Marmion. I'm 79 years of age. I live alone. And appreciate what's all done for me by alone. Their phone calls in the morning, their technology, their laptop, my watch that keeps me fit, and I keep watching it. It keeps me in touch with my daughter in America and my other daughter who lives in Waterford with her family. If you are lonely, just lift that up, and you can either do solitaire or different games on it, and it just takes your mind off of what you were thinking of and different things like that.
This project has a number of key learning objectives to inform Alone and wider national practice. We want to explore older persons' attitude to technology, the changes in behaviour people make because of better information, the role technology can play in technology provision, the support and training required to encourage people to adopt technology, encouraging older people to manage their health and well-being in an innovative way, and the reaction and attitudes of medical professionals. On behalf of all at Alone, thank you for listening.
Have you started your nativity play in school yet?
No, I haven't.
78-year-old Mary Dunn from RD is looking forward to Christmas. Although she knows it won't be the same this year, she says technology will make it easier. Without it during lockdown, she simply wouldn't have coped.
I love meeting people, I love chatting to people, so it would have been very lonely if I hadn't had my phone or my iPad.
The grandmother of 17 says she's still learning. Today, her grandson Christian, who's in her bubble, is showing her Zoom. She says older people shouldn't be afraid of technology.
Now I can book the holidays or go online if I wanted something, or Google. Mr. Google is my pal. But you don't have to go deep into it. You learn what you want to learn. Hello, Jack.
Hi, Granny. I always used to go into her every morning and before school, and I love the way technology makes you see her and actually hear her. Some grannies don't know how to do that, but my granny does, and I really like that.
Age Friendly in Louth is hoping this campaign will resonate with people across the country.
We all know that health and well-being depends very much on staying connected. And of course, this Christmas is going to be a very different Christmas, but we can still make it special if we stay connected.
Age Action has a step-by-step guide to getting online, and Mary Dunn has this advice.
Just get connected in your own simple way and you'll never be on your own.
What is Hands-On SHAFE? SHAFE is a simple umbrella acronym for Smart, Healthy, Age-Friendly Environments. The S is for smart, such as smart technology solutions, smart built environment solutions, smart business solutions, and smart healthy solutions. The H is specifically for healthy, and we consider both the mind and the body solutions. And the AFE is for age-friendly environments. So in summary, it's smart and healthy solutions that will help keep our environments, homes, streets and technology all age-friendly. The hands-on emphasis refers to activities that are initiated from the ground up at a community facilitator's level. Some people may consider it a buzzword or a jargon term, but the real power of the acronym is nested into its context on the wider European stage. In 2019, for the first time in history, the number of children under the age of 5 was less than the number of adults that were over the age of 65 on our planet. Currently, 12% of the population is over 65 years, and this is expected to increase to 24% by 2030. This is a massive shift on the demographic landscape, and it means there will be more people relying on our economy in the form of pensions and social support than will be net contributors to it. Consider a graph with the number of people along the bottom, and the vertical is the cost to the economy of supplying a particular service. If we then overlay 4 tiers, Tier 1 represents the population at large, all of us who can live and age at home, but stay as part of the community. This is the lowest cost to the economy of all the tiers. Then there is a ladder to bring us up to Tier 2, which is a low dependency home care. People who can live and age at home with a little bit of support that's available in the community. It costs more to provide this additional service, but there are less people needing this provision. Then there is a ladder to Tier 3, which is dependency care, such as nursing homes or clinics. As you can see, there is a large cost to the economy for this profile, but less people need this service. And lastly, there is a ladder to Tier 4, which is the high dependency care, such as hospitals or care facilities. Now, ladders can work in both directions. Obviously, we can have people move up the ladder, but with some assistance in the form of smart measures, we can also allow people return down the ladder too. Remember, the more people that are at Tier 1, the less cost it is to the economy. So, how does Hands On Shafe intend to do this? Consider a couple leaving a home in the community. They are feeling isolated due to the lack of digital technology and cannot make appointments or make internet phone calls to friends or loved ones. So, with the help of a trained ICT Shafe facilitator, they could be assisted on how to use a smartphone or configure a Wi-Fi router or load software onto a tablet. Another example might be perhaps where one of the couple has a problem opening doors, accessing sockets, or perhaps using knives and forks. There are many life hacks or assisted technologies that can be used to assist the person or a couple to stay at home, live in place, age in place, and be part of the community. But they can only be assisted if the person knows about these particular services. Hence, the roles of a hands-on Shafe is to offer training to potential facilitators on how to effectively and efficiently provide this service. In some cases, this facilitator may be an existing caregiver, a family member, friend or volunteer, or in some countries the person may even be a retired person looking to help out in the community, or somebody that's between jobs, or perhaps a person that might want to start a sustainable business in this space. To finish up, some of the great benefits from this international collaboration are seeing solutions jump across borders and cultures. These workarounds that could be reused again and again with our partners in France, Germany, Ireland, Poland, Portugal and the Netherlands. So if you're interested in knowing more about Hands-On Shafe, here are the contact details.
Isaac Care. Isaac Care is the complete independent living solution, comprising of a free mobile app which facilitates easy communication within circles of care, supported by a range of smart, ambient care devices and a 24-hour clinical support service. Keeping everyone connected and supporting our users to live safely, happily, and independently at home. So let's see Isaac in action. Meet Mary. She lives alone and leads a very independent lifestyle. She enjoys going for daily walks, but is concerned about falling. She also has issues with her blood pressure, which needs to be monitored. Her daughter, Sarah, is concerned about her mother, but can't check in as often as she would like. Since implementing the Isaac Care solution, Sarah has had peace of mind that her mother is okay. She gets regular notifications on the Isaac app about her mother's activity throughout the day. She also has reassurance that Isaac Care's dedicated team are on hand to provide support 24/7. Sarah has found the circles of care great for communicating with everyone involved in Mary's care, allowing her to easily keep everyone up to date. She has set up different care circles for extended family and neighbours who are on hand to check in if needed, and even Mary's GP. We supplied Mary with a bespoke kit featuring smart motion sensors, a smart blood pressure monitor, and the Isaac pendant, which can be used to call for help anytime. Mary has started taking her blood pressure daily. Her readings are transferred automatically into the Isaac app and are monitored remotely by our clinical team. She takes the Isaac pendant out with her everywhere she goes, allowing her to maintain her independence, while knowing our team are on hand to help with just a push of a button. Isaac in an emergency. One day, Mary fell while out gardening. She called for help using the Isaac pendant, and our care team made sure she was seen to quickly. The doctor advised Sarah that Mary would need some extra help for the weeks following her fall. Isaac's trusted partner, My Home Care, stepped in for those few weeks and gave Mary the support she needed to get back on her feet. Mary is now back to full health and has the confidence to maintain her independence, knowing that the Isaac Care team are there to support her. To learn more, please visit www.isaac.care.
Well, I think those videos really set the scene for the next part of this morning's seminar, which is a panel discussion. And I'd like to welcome our panellists here this morning. We're going to discuss how do we advance social participation through technology. We have 5 panellists, so while they get their cameras on, I'm going to ask each of them if they could to give us a short introduction, just to tell me who you are and what work you do. So I'll kick things off. And I'll get Sean Moynihan from Alone if you want to give us a brief introduction about who you are and what you do.
I'm going first because I think I was first to turn on the camera. Good morning, everybody. Delighted to be here. What we do in Alone is we, as per the video, I suppose, we support older people to age at home. And how we do that is through a network of staff and around 3,000 volunteers, and in partnership with around 70 other organisations across the country. We try and empower and support older people so they can stay in their homes where they want to be for as long as possible. I think what this network allows us to do then is to distribute, install, and respond to the different technologies that meets the older person in the place that they're at.
Great, Sean. Now, Vicky Harris of Age Action.
Hi Sinead, and thanks for having me. So I work with Age Action, and Age Action is Ireland's leading advocacy organisation for older people and all people as they age. So in addition to our advocacy and policy work, we provide services to approximately 6,000 older people every year. We have 2 major programme areas, the first of which is Care and Repair, which is the free DIY maintenance service that supports people to live at home in comfort and safety. And then we have our Getting Started programme, which is a digital skills programme, training over 43,000 people on a one-to-one basis in the last 10 years. So thanks a million for having me, and I look forward to the conversation.
Great. Thanks, Vicky. Joan Martin, we heard from Joan earlier this morning, CEO of Louth County Council. Don't know, can we hear you, Joan?
I've been involved with Age Friendly since about 2009, and I became involved in the European Covenant on Demographic Change as a result of some of that work. And I suppose the Covenant is interested in spreading the use of the WHO age-friendly communities and cities, and getting more and more cities and regions to sign up to developing age-friendly environments for their older people. So I suppose, and we're also involved in this type of thing, webinars and seminars and spreading information. So I suppose that we're interested in helping today's people, but also trying to ensure that we create the best possible age-friendly environments going forward for people like myself who are on the cusp of that. Older people, I'm probably over it actually, I try to pretend I'm younger than I am, but people like myself, that we can have better hope of being able to. So it's been a very exciting morning so far, and really enjoying it, and thanks so much to everybody.
Great, Dawn. Now to Philip Hogan of Cliff Run Health and Media.
Hello, Sinead, and thank you for the invitation to participate today. Very informative event so far. So my name is Philip Hogan. I am CEO and founder of Cliff Run Media, and we're developers of the Acorn Smart Tablet, age-friendly smart tablet. We now have a network of over 80 organisations across Ireland who support communities of people who need that additional help to go online, where existing technology is just a little bit too advanced for their requirements. So we've a network of over nearly 2,000 users in the country today.
Thanks, Philip. And finally, last but not least, Declan Murphy from Service Source.
Hi, good morning, Sinead. Delighted to be here. I'm Chief Executive of My Home Care. And about 6 years ago, I was at a conference in the UK, and the UK Home Care Association spoke about reducing half-hour visits to visits of 15 minutes in terms of paid home care. And that really troubled me, because being in the business, I didn't see how we could actually deliver a quality service in that short space of time. So we started exploring what technology might do to be able to assist us to deliver a high quality level of personal care. And that's when we discovered Isaac. And through other European programs such as Vizier, and working with University of Geneva and Dublin City University, we were able to bring the technology to its commercial stage where it's at now. And finally, we're delighted to be associated with Louth County Council and with SHAFE, the Louth Super Connectors program. I think Louth is a real hub for this type of technology development. And we're looking forward to seeing the formation of the Connected Health Hub at DKIT here locally in Louth as well over the next couple of months. So I'm really delighted to be on the panel.
Grace, thank you, Declan, and thanks to all our panellists for taking part this morning. As I said, what we're going to discuss is how do we advance social participation through technology. If you have any questions, you can pop them into the chat. There will be time at the end, and we can get through them. So please don't hesitate. Any questions, we'll hopefully be able to get to answer them. We'll begin, I suppose, looking back on maybe the last year or so. We don't want to dwell too much on COVID. But obviously it's had a major impact on technology for all of us, but particularly for older people. So I'll begin with Sean, if you don't mind. Sean, I suppose, how have you seen, or how has Alone seen the increased use of technology, and how have older people, I suppose, been faring in that space over the last year or so?
Yeah, I think technology, I think for a long time people have understood that technology can support older people and empower older people to monitor their own health and well-being, to remain connected into their communities, and also to manage their self-insecurity. An irony of such a devastating effect of COVID on older people is, in the reverse, is that the opportunity to use technology has come. So many services, and you've seen this in other videos today, and other services have reorientated towards the home and supported, and the technology has been part of that offering there. You know, I think the biggest thing that has happened is behavioral change. And that older people were always interested in. I see in different videos, everybody had people in their 80s, their 90s, really thriving on technology. And that's our experiences, projects all across the country for many years around technology, and even working with Network Casala for many years, and many others here, is that older people were always waiting and wanting to get involved. But now I suppose the behaviors of all the organizations, the healthcare system, the social care system, families, we've all seen these as tools that can move forward. For us, we probably provide, you know, we would have moved to a situation of supplying around 2,000 people just in COVID with extra technology, with extra resources. And then we ran a big project with Sláinte Care where we took 50 people home from hospital who had dementia issues, and ultimately is use technology as well as the human supports to actually help them age at home. So I think what has happened is we've had an accelerator event, a disruptive event, where basically people not only trust our technology more now, but also the behaviors of all the organizations, the healthcare system, whereas we knew the value, now people are happy and the processes have changed. And I think in the next couple of years, older people will have huge benefits from that and huge abilities to be empowered, to be supported by this, and to drive human contact and connect all the different parts of people's lives, whether it's health, social, participation, family. And I think that's the value of all the initiatives that we've seen today and many other that are going on.
So it's one of the main things, and you just mentioned family there, John. You know, it's that it's been able to have been connected during a period where, you know, we couldn't physically see each other, but it just came into its own, really.
It moved to its next level. I think one of the videos for Drogheda District, the man was talking about keeping in touch with America, and probably before this he probably never would have thought of a video call, so he probably couldn't do that. He'd have done that anyway. So I think, you know, there are a lot of drawbacks, I suppose. We always think of the Twitters and some of the Facebooks and some of the negative drawbacks of technology and all that, but I do think we can drive human connection. I do think we can empower older people. I do think that we can ultimately use technology to solve problems that we can't solve with humans, you know. And I was talking to one of our tech engagement officers there a few weeks ago, and he was telling the story of just bringing a man home from that, one of those project participants who had dementia coming home from hospital. He used to sing in a choir. We now have him connected to his choir on a Wednesday. Because of dementia, was struggling with all the different remote controls. He's using his Alexa to change his TV station, as well as then obviously the types of supports that us and others bring to him. So much more empowered, much more in control of his life at a time that he's facing some difficult challenges.
And just to bring Vicky Harris in there, Vicky, I suppose, you know, technology moved so quickly. You know, we do have to accept as well that there is challenges too for older people to kind of stay abreast. But Age Action, I know, have been working, you know, to try and get people online, get them set up, get them organised.
That's it, yeah. And as I said, we've worked in digital literacy and digital skills for the past 10 years, and we would see a real benefit on providing training on a one-to-one basis, because there's a connection as well, like what Sean is saying, there's an importance around the relationship between a learner and a tutor. But I suppose it's important to remember here that while technology has saved a lot of us in the past year, and we've got to see our family and friends, and we developed a program around that simply to keep in touch with people, that we do need to remember that there are challenges, in the sense that I think the most recent data was that the 21%, I think, of people between 65 and 74 have never been online, and over 50% of people over 75 have never been online. So it's important to remember that there are blocks to getting online. CSO data from 2019 of people over 65 or 60, sorry, of households over 60 suggested that lack of skills and then the cost of getting online are major challenges to being digitally literate or included, let's say. So what we would advocate for in Age Action is that people have a choice, and in order to have a choice, services need to be affordable, and also training and skill sharing needs to be accessible. Our experience in Age Action is that age is not, it doesn't limit you with your skills for technology. Age is not a reason why people can't use technology, and actually people are so capable and so competent. It's more about confidence and overcoming the fear of knowing that you're not able to break your phone or you're not able to break your smart device. And actually, as soon as people realize that, they're good to go, you know, the world is their oyster. But we need to come back to the idea that cost is a prohibitive factor, and also the accessibility of training. So we really would advocate for choice and for services to remain offline as well as online, you know.
Yeah, and you mentioned their fear. We saw with that Super Connectors program, you know, that the grandson, you know, showing the grandmother how to do it. Yeah, I suppose it's trying to get everyone involved to take the fear away from it.
Yeah, that's it, because there's nothing to be afraid of, you know. And Super Connectors is an amazing program, and we worked quite closely with Age Friendly Ireland with that, because we have a certain curriculum that gives you step by step in accessible language on how to get online. But that's it. That's what's got it through the last year, is connections with our family and friends, and technology has allowed that. So it's really brilliant. It's a really brilliant program. We'd commend Super Connectors for it.
Great. To bring you, Philip Hogan, in, if you don't mind, you created the Acorn, the age-friendly smart tablet. Since that came on the market, what sort of trends or changes have you come across among those who are using the tablet?
Yeah, so we've seen, clearly, we actually brought the product online just before COVID, and immediately saw an uplift in family members and organizations who were taking on the technology to support an older population. Obviously, COVID has had a significant impact in terms of adoption. But one of the things that I think is worth kind of raising here is that standard technology, a one-size-fits-all model in terms of technology, is not going to work. And we've taken the view that you have to build and design with an awareness of the challenges of people who've lived in an analog environment for most of their lives, and then adopting this technology, which is moving at an incredible pace, that unless organizations like our own change the way you interact with technology, that battle is going to be too significant. There's too much requirement for third parties and infrastructure to come in and support people with the existing tech. So we took the view, build something simple, build it in a way that allows for full independence, that retains the dignity of that person, that they're entitled to all the services, digital services, but make it possible for them to interact like everybody else, but on their terms. And with that in mind, I think what's happened in the last year for us is that we've seen adoption, rapid adoption, mostly through word of mouth across the country of Ireland. So we're in every county in Ireland today with over 80 organizations. But what we found is that it wasn't being used just for connecting older people, which is a key facet of its use, but anyone who was marginalized by digital technology, existing digital technology, could now use the tech. So we had children from disadvantaged communities where broadband wouldn't have been in the home, or access to tech or knowledge of that wouldn't necessarily be within the family infrastructure. Adults with learning difficulty were using the technology because it was simplifying what is extremely complex. We take it for granted. Swipe and touch makes it seem easy, but it's not. And unless we make a move to support this community at a technology level, we're not going to have the infrastructure to meet them. So using that, we found it used as a learning tool in libraries that we hadn't expected. We found it used to support individuals who are going back to work, people with addiction issues. So the wide range of people who are marginalized by technology should be addressed rather than look necessarily specifically at one demographic.
And Philip, I suppose I'm just looking at a comment here from Suzanne Smith from Network Casala, and she's saying that research shows that older people are willing to get online, but she says, you know, while fear and cost is relevant, broadband access is a key factor. Is that something that you've come across?
Absolutely. So one of the facets of the product that we built, we had from the outset put mobile data into the tablet, so it has a SIM card and it's accessed wherever you go. And its original intention actually was so that we didn't confine use of technology to the home, that it was to encourage the confidence build to use it wherever you may be, in coffee shops, waiting rooms, and that it was being used in a context similar to most other people were using it. But what happened in COVID was that we realized how many people had no access to broadband. And obviously the infrastructure was put under great pressure because everyone, the entire population of the planet rushed to broadband. And of course, the infrastructure providers were under pressure then to support that. So having mobile broadband built into a tablet for many was really important and became a bit of a lifesaver for the organizations that were trying to communicate with people who had nothing at home, essentially, in terms of broadband.
Declan Murphy, we'll bring you in here. Tell us about the Circle of Care app, and I suppose, why did you feel the need to introduce something like this?
Yes, Sinead. Well, we designed Isaac to be technology agnostic. We came across through our trials a lot of very useful pieces of technology, but adoption rates were quite low. And what we decided to do was build a software platform that was secure, that was user-friendly, and that could provide the relevant information to the relevant people. And therefore, Isaac uses circles of care to group certain people around the service user. And if we take an example, we could have a GP, a public health nurse, the primary carer, and the service user within one circle, and they share medical information together. We can have family members and the service user in another circle. They don't see the medical information, but they do see messages, calendar appointments, and stuff like that that are relevant to them as well, and they can be involved in personal care. And what it's designed to do is really to, first of all, support all the unpaid carers that are out there. So it's free to download from the iOS store and the Android store. And basically, anybody can set up a one-to-one relationship on the app and then start to monitor vitals straight away. And then we get involved when people need enhanced levels of care. We provide a full 24/7 wraparound service where we have carers on standby if somebody needs an intervention at that point. So it's an end-to-end solution, fully supported and at the appropriate level.
And how are your carers managing with the technology, or how is that part of it going?
Well, it's going really well because one of the things about providing care is it's generally on a one-to-one basis. And there are high levels of anxiety where family members may not be living at home and they want to know that the carer has arrived on time, that they've delivered a good quality standard of care, and they've left on time as well, so that the person who is receiving the care. So we, very early on, we introduced mobile GPS apps on the carers' phones. We deployed those again free of charge, and they're using them now as they walk into the actual home. They press the app to say that they've arrived, and we can verify that through a GPS stamp. And we can share that information then with family members through the Isaac platform. So it really reduces the levels of anxiety that are there. It also then shows that we can demonstrate that we're actually doing things like the activities of daily living. We can enhance then the personal care that we provide with technology by deploying the Isaac pendant, which measures falls risks. It also measures location. And then we can introduce sensors within the home that are linked through a Bluetooth mesh and then have a hub to the cloud. And this is all deployable out of the box. So you don't have to know how this technology works to be able to use it. And what it does is it monitors the person's activity around the home on a daily basis. It learns that pattern over a period of a number of weeks. And then if anything happens that's outside of that pattern, it raises an alert to the primary care or to the actual family or friends, whoever is actually in that circle of care. So they can respond then to things that are not normal within the family home.
Okay, great. Joan, if I can bring you in here, I suppose we're seeing a push towards government e-services. You know, everything to do with banks is now online. From a regional policy point of view, how do you see policy assisting people in the increased use of technology?
Well, I suppose if listening to what's going on here today and like from the last number of years, it's obvious that there's loads and loads of technological solutions, and we've just been talking about some of them. So there's huge technological tools and facilities that are there that can help. But what's equally obvious is that there is a huge issue around technology poverty. And that it's very important, as Vicky said, and I would feel very strongly about it as well, that we don't create a two-tier older people's society of the techies and the left behindies, and that's really important, and that policy must address that. It's also clear, listening to Sean and watching the videos, that the technology might be there, but you have to introduce it, you have to help, you have to have the links, you have to have the infrastructure, to help pull all of the things together. So that whole the policy must address that. It won't be enough for government to say there shall be e-services and we're doing all your doctor's appointments online from now on. The whole package has to be there to make sure that all the opportunities are there for older people to access and use the service to the optimum. And the whole issue of cost and technology poverty and all of that also has to be addressed. It has to be looked at in a holistic way rather than just saying let there be light and it'll just all happen magically, because it won't. Dealing with older people and bringing all these services along in some cases can be hugely labour intensive. Other people take to it and didn't need any help and we're at it already. It's equity. The equity is there, and that the service is there for all, and that everybody benefits from this fantastic technology that we've seen some of this morning. So I think it's important that policy deals with all aspects of delivering the e-service and not just saying let there be an e-service.
Absolutely. I suppose how important, and I think we saw in some of the videos there, you know, the fun, you know, the Drogheda, we saw in Drogheda with the older people. How important is it that there, you know, that fun is linked to technology to encourage people to use it? I suppose that may be for Sean or for Vicky to answer.
I can take that, if that's okay, Sean. We would say that obviously fun is so important, but also no one does anything unless they know the reason why, you know, like things have to be relevant. I think, again, the one of the effects of COVID is that keeping in touch with people on a digital level has become so important. So that in itself has become a motivator, because you get to see people. And when we were all so isolated in our homes, all of us, it doesn't matter what age, digital technology became so important. So that was the motivation in itself, that we could stay connected, you know. So that really does make a big difference. We have found, again, in Age Action, because our training is one-to-one, and then most recently we've developed a Getting Started Kit program, which is still one-to-one, but it's remote to make sure that everything is safe. That really one of the biggest benefits of that training is increased skills, of course, but it's the relationship between the learner and the tutor. And when we did a review of the program in December, words like liberated and, you know, people felt free again because they could access this world that they just didn't know existed. So there's massive benefits to going online, but it's just about supporting people in the right way and making it real, you know, showing the reason why, what the benefit is.
And Sean, maybe you might come in here. I suppose it is important to encourage people and support older people.
Yeah, our experience is that a lot of technology actually solves problems for older people. And what it means then is people feel much more empowered. I think in one of the videos, somebody talked about watching their steps every day. I know with the Healthy Ireland program we're doing with Louth, we have situations where people are using apps around healthy well-being, how they're then managing their own chronic diseases, how they're connecting into the community. So I think when something solves a problem for somebody, gets people home from hospital, I love Shafe's diagram of the ladders. And it's about getting people as much as possible. Maybe somebody goes into hospital and goes in and needs acute care, but then we get them back down to the ladders at different areas of then being empowered and reconnecting in. And I think where the uptake and the interest for older people is that empowerment. It is that social participation. And it is, remember, dealing with adults, the ability to manage their own health, their own well-being, and connect in with and use this to solve the problems or challenges they're facing, and hopefully some of them for only a period of time, and then they can step down from it. And I think what I'd say to you is, you know, there's a lot of great technology out there. Some of it people will use for short periods of time. You know, that could be blood pressure monitoring coming home from hospital, and then stop using that because ultimately maybe the issue has passed. So I think all of this, and I think this is Joan's point, which is wonderfully well made, is this is about building the infrastructure that we can distribute and respond to the different types of technology that have been developed and will be developed in the future. Everybody here is rightly proud of what they've developed, but it's also about us all connecting everything together.
Philip, I have a question just in here on the Q&A. Is there a cost to buy the Acorn and any service charge?
Yeah, so the way we operate the Acorn is one of the principles of the Acorn was to make sure that it was commercially similar to other technologies, that if you were older, you didn't have to pay a significant charge for our product over somebody else's. But one of the things that we also introduced was that you do need help. And I agree with Sean and Vicky's approach. There has to be an infrastructure to support people as they move through it. Our objective is that that support is short, right? That in essence, that your adoption rate and the intuitive learning of the technology should be so short that it doesn't plus great onus on huge infrastructure requirements to support people on an ongoing basis. But in that regard, so what we do is we have a license fee for the technology. We integrate the the mobile data, so the person doesn't have to go out to a mobile operator and go through all that, which can be stressful. And then on an ongoing basis, we keep the technology up to date with things that are relevant in their lives. Again, Vicky made that comment. I think it's absolutely true. If people are going to adopt tech, it has to be relevant. So we have a big aspect. We have three elements to the product. Help people remain informed. So get information in that the digital world does a great job of. Help people remain interactive, both professionally and also in the context of social interaction. So both are important in the lives of people who are digitally independent. And lastly, keep them involved. And that involvement's a big part of what we do. So we work with all the local authorities around the country, bringing in content that we think is going to be relevant and activities that might be relevant to them.
Great. I have a message from Suzanne from Netwell. Most healthcare assistant training courses would include some level of digital skill training, though mostly on how to use tech to complete the course. Knowing how to use tech and how to show older people how to use tech are somewhat different. We need some research on this to inform ongoing training for carers as the technology changes. I suppose, Declan, you might be able to, what you're hearing or feeling on the ground in terms of that for carers.
Yeah, I think we need to look at, I agree with that entirely, innovative ways of making older people more comfortable with technology. And you mentioned fun earlier on. I'd point to an example of one of our trial service users whose interest was buying and selling farm machinery. So in order for him to engage with the Isaac technology, we loaded Done Deal, which is a trading website for farm machinery, on his iPad. And every day he was recording his blood pressure and he was carrying his pendant because that reminded him to actually do that. And he had then the actual social interaction of buying and selling as he went along. And we have numerous examples of where you can actually assist older people become more comfortable. So for example, there are things like banking, ordering your shopping, doing the daily activities of daily living that come naturally to them, and then you mesh in the personal care. And again, that's why we sort of built Isaac on an agnostic platform, because we've now integrated with Withings, for example, and that measures weight, blood pressure, all of your vitals. We've integrated with Fitbit. So if you already own a Fitbit, you don't need to go out and buy a new piece of technology. You can just link your Fitbit to the actual platform and it records your steps. And that's the direction we're moving here. We talked about the cost of technology. When we started looking at this 5 or 6 years ago, it would have cost nearly €2,000 to fully kit out a house with this type of remote monitoring and ambient sort of sensor technology. Now you can do it for €150 and you can spread that cost out over a year. So it becomes negligible really in terms of the cost of care. Again, if you look at that pyramid of cost that we saw earlier. So I think it is becoming more affordable. We have to look at innovative ways of adopting the technology and making people more comfortable with it. Because I have to admit, like I would walk into a computer shop and I'd look at the actual, the stand that has all the smart equipment on it, and I wouldn't know where to start. And I think there's a gap there that we need to address as if we're going to offer technology in the marketplace, especially to older people.
And I suppose what happened here then in the last week or so, the cyber attack on our health service, that won't have helped trust in technology. And I suppose that's another battle, is to try and, convince older people that, it is okay when you see something like this happening. I don't know who might want to take that, I suppose.
Well, I was really impressed with the 4 priorities that the Drogheda Service for Older People set out there, and practical security and personal support, social connection, legacy growth. I've noted those because, you know, I mentioned anxiety levels earlier on in terms of deploying technology. You know, I think the more that the health service executive works with private innovators, I think that will help advance that and protect people's credentials. You know, we as a care organization, we signed up to JCI, which is the international gold standard for the provision of care. And, you know, that places obligations on us to secure people's data. We've also got the ISO 27001 standard in place, which it gives confidence to our service users that we're managing their data in a responsible way. And then finally, and most importantly, GDPR. I don't think companies really understand the obligations that are placed on them in terms of storing people's technology, the relevance in terms of why, and the duration. So I think these are questions that we all need to consider when we're looking at technology and managing people's personal information.
Would anyone else like to come in on that? The cyber attack and the trust?
I think just our experience has been confidence. I think it's been referenced a couple of times in the conversation already. And one of the disappointing elements of the cyber attack, notwithstanding the impact it's had on the public health system, is that it sets back confidence, particularly in those that haven't established that yet in technology. And what we found is that if you build confidence, irrespective, then people will adopt and will take on any aspect, whether it's Fitbits or additional assistive technologies. They will grow in confidence. Cyber attacks are a significant issue. Fortunately, mobile technology is somewhat, compared to laptops and PCs, is a little bit more immune because of the rigor that goes into app development and app checking, but it is an issue for older people for sure. And certainly the last week has probably set people back in terms of their ability, for example, to go into finance, which is a big aspect. We looked at that in terms of banking, huge reluctance for people to take that on, and this won't help.
In terms of websites and apps, you know, sometimes you can find that, you know, even trying to get into Zoom, it can be a little bit complicated. Do you think we've a long way to go in that regard in terms of making websites and applications age-friendly?
Well, that's a really interesting point. In fact, at the moment, we're building and we'll release an age-friendly Zoom. So one of the things that we're impressed by Zoom, of course, somebody said that 2020 was the year of COVID and Zoom, because I think the entire planet took on Zoom as well as taking on the burden of COVID. And one of the clever things that Zoom have done is they've opened up APIs. So they've allowed organizations like mine to develop interfaces that are simpler for that particular technology type. We have, majority of our users are using Zoom in some context because it's the social interaction platform of choice, you know, globally practically. And having organizations think smart about, actually there will be a cohort that will need this in a different format, because Zoom is complex, right? There are people who are challenged trying to find where the mic turning on and off aspects of that. It's a brilliant service. We're using it today, but it requires, for a cohort that is not familiar with tech, we need to simplify aspects of it because there's way too many options for the average dial in. So the fact that they're modifying their interfaces is fantastic. And others, one of the things that we'll advocate in our product is that change in utilization, and that websites can become age friendly without too much difficulty.
Thanks.
What I'd say on that is there's a wider issue, which is, you know, we have an aging demographic, which is wonderful. So every government department, a bit like global warming, needs to have a plan about age-proofing policies and practices, whether that's transport, whether it's the houses we build. You know, everything needs to be accessible for all of our community, and obviously older people make up a large percentage of that community, and plenty are jumping the digital divide, and what we need to do then is target those who need support, training, to actually jump that divide. But I think I think in the next 5 years, we're going to find in our country the conversation about age proofing and age design is going to cut across all government departments.
And just to read out a question, well, it's not really a question, more of a statement. I suppose a lot of older people are afraid of buying online and giving their bank details. So I suppose either Vicky or Sean, if you want to come in on that, your experience of what people are telling you.
Yeah, again, it goes back to this more fear of a device, and then going back to the idea of GDPR and understanding that, and even the amount of consents that come up and the amount of text that's in consents, that can be quite overwhelming for anybody to read through all of that. So yeah, there's definitely, we found a hesitance to do banking online. But again, as soon as somebody does it for the first time, then suddenly, the fear is gone, and the fear of the unknown is gone. So it's about trying it, understanding rights, understanding GDPR, and reading through some of that text and not being afraid of it. And then when somebody tries it, usually they're as good as anyone else. It's about overcoming that first hurdle.
Another question here. We find that some older people are very reluctant to pay for any internet broadband connections. Should we lobby the government to include broadband as part of the household benefit package?
If I could step in there. Oh, sorry. Go ahead, Phil. Oh. Sorry, we would advocate that there is some sort of an allowance in relation to digital. The cost of accessing technology is a lot. So there's two costs. There's a once-off cost of accessing a device, and you have to upgrade that device maybe every couple of years. And then there's an ongoing cost, assuming that you have access to broadband. And we welcome the rollout of broadband plan, but still people can't access, as Suzanne said it there. So we would absolutely advocate that there was some sort of allowance or a digital allowance to make it more accessible to people. And particularly in the context of people over 65, 2/3 of people over 65 rely on social protection as their income. So a monthly or a once-off cost makes a really big difference in the amount of money that you have to spend per month. So it's about making it more accessible.
I have a question from Damon Berry here. What is the single most important policy measure that could be implemented in this space by authorities? So I suppose I can open up to whoever wants to come up with that single most important policy measure. So
that's an awful question.
I think
thanks very much, Damon. That's really a terrible question. I mean, to me, in the last minute or two, it's not maybe a direct answer, but to me, one of the things, and something we were trying to do in Louth after becoming an age-friendly county, as we developed a new county development plan, as we were doing our local economic and community plan, is that we tried to embed. It's no good having an age-friendly section in the council and having an age-friendly officer. It has to become part and parcel of how we do business. And I think, at the moment, there's a lot of push on everybody to have climate action as part and parcel of how to do business. And age-friendly needs that. It could be a policy thing. It's like GDPR, it should become part of how organisations think. I suppose I was also saying to myself now, I spend my entire life online at the moment. I'm sick, sore and tired of it. I keep saying we all should have PhDs in how to use Zoom, and yet we're still told, Joan, you're on mute, and this kind of thing. So if who does it all day, every day, if I'm struggling with something, or if I go onto a website and I'm saying, where is it? And I'm going, well, then it's not age friendly. Because older retired people who don't do this all day, every day, if I struggle, they're certainly going to find something is not intuitive and easy to use. But I think it means that organisations, the public sector, has to think, architects, whoever it is, if you're doing something, think, is this age friendly? Have I adopted age friendly principles? Is it universal design? Is it for all users? So it's really a mindset, because otherwise a few of us slogging away worrying about age friendly, we're not going to change the universe. And that's what's needed. It's a whole attitudinal change, policy change, design change, everything change, but it has to be embedded. It has to be across everything. That's it.
Sinead, if I could just add to that, I think if we just step back, you know, a little over 12 months, and we looked at the state of the health service here in Ireland, there were long waiting lists and trolley queues out the door as well. And suddenly we got to a situation where there were very few people attending hospitals. Now, there is pent-up demand, and we have to recognise that. But I think it's time to look at what levels of care can be delivered in the community and levels of support, and really invest in preventative measures. And I think that if you use technology in a proactive manner to be able to have not just older people, but just people engage. Like we look at 4 areas. We look at frailty and falls. We look at diabetes, disease state management, and dementia. And if you look at those 4 cohorts of people, there are about 1 million people in Ireland who are touched by that in some way. And by addressing those in a proactive manner and you know, supporting them at home through technology, you're avoiding this sort of rush through the gate into A&E or into hospitals, and you're taking the pressure off the system long term. And I think we have a unique opportunity to address that right now before we get back to the norms again that we had back in 2019, 2020.
Right. Final question to all the panellists, and I suppose if you can keep your answers as brief as possible. How in the future can IT unite us, or perhaps it has united us?
I think I'd start and echo Joan's comment. I think universal design is critical. If we design, somebody said, if we design for the old, we design for everyone. And as technology considers the 12%, as Vicky referred to, of the population, then we have a chance at being inclusive and creating digital citizens, everybody as a digital citizen.
Sean here. I think we're sort of around the use of technology, and that we're very much in the innovative stage where a lot of people coming forward, innovating, pushing things forward. I think to answer the question somebody said about the big policy change, what we need to do then is have the situation, whether it's healthcare systems, housing providers, local authorities, everything else, is that we see technology as part of the solution, and it's stuff that items are funded or supported and training given, and it's seen as part of that solution. And we go from the innovation phase to actually demonstrating onto actually scaling solutions around the country. And I think that's the journey we're on, and it's conversations hopefully like this morning that bring that forward, and the work that's being done.
I would say that the last year has shown that definitely IT brings us all together. There are, you know, unlimited amount of benefits that comes from IT. But what we would say is that we remember that the cohort of people who aren't online, who can't access technology, and there will always be a group of people who just choose not to, and that's their choice. So there should be services that are available offline always to support those people. And for those people who choose to be online but can't, we should be supporting them from an access, a financial perspective, and then also to have appropriate training available for people to get online if they choose.
I suppose just to add, you know, I think listening to the breadth of the conversation that we're having today, I think the terminology that we're using is common across a number of different services that are being provided. I'm referring to things like personal safety, autonomy, and independence, and these are elements that people value. And I think as long as we respect that and we design our interventions with those in mind, and they talked about dignity in the Drogheda services earlier on as well. I think that's hugely important, and respect. So, you know, I think we're seeing a convergence at the moment. I think, you know, policymakers, public authorities, they have an obligation now to introduce technology as an element in terms of tendering for services and public services, so that we can promote innovation and promote this type of conversation.
Right. We could, I think, talk all day on the subject, and I think it's important as well that we are talking. and looking towards the future. But thank you all for your contributions. Really insightful and really interesting. And let's hope the conversation doesn't end here today. We're going to take a short 5-minute break. So I think that's just about enough time to run down, boil the kettle and get a coffee. We'll see some videos during the break showcasing all that County Louth has to offer. So enjoy, and we'll be back shortly.
Thank you.
So I think we're finished. That was a short morning. Welcome again to everybody. And our next section is as interesting. You would agree that that panel discussion, it was really, really interesting and really insightful. And I suppose, you know, we all hope to grow old. So it's important, you know, to talk and to plan for when that happens. Our next section, as I said, is a bit more European focused. And we're going to hear from Claudia Fernandez Rivera from TU Dublin. And she has looked at policy on social participation among our European partner regions. And then she'll be followed by Conal McGettigan, a senior executive planner with the Northern and Western Regional Assembly. And he's looking at the future of the regional operational programmes in Ireland. Of course, if you do have any questions, don't hesitate to put them in the chat function. Any questions we don't take now, we will try and answer once the session is over. And of course, this session is being recorded. So if you do have to nip away or you've missed part of the session, you can look back on it later on. So Claudia Fernandez Rivera from TU Dublin, with her analysis and her look at social participation among our European partner regions.
Hello, everyone. I am Claudia Margarita Fernandez Rivera, a researcher at TU Dublin. My team and I prepared this 20-minute presentation, but I warn you, it is a little bit dense. However, we try to make it as simple as possible. So let's get right into it. This presentation is about a policy analysis that we did on social participation, and I'm going to show you the results. We designed and carried out a survey among partner sites on various issues related to social participation in the regions. Now, every topic analyzed is going to be talked about separately. The participants were Louth, Vizcaya, Aarhus, Coimbra, Hamburg, and Slovenia. First, take a look at policy instruments and social participation. Now, a disclaimer. Social participation and social inclusion can be considered different, and that is an ongoing debate. But here, we have to draw the line, so we are going to talk about just social participation. First, we wanted to know which regions had an operational program that included social participation as a thematic objective. Turns out, just Slovenia and Coimbra do. But what is social participation? Now, I am not going to go into a lot of details here. Bottom line, social participation starts when one interacts with another human being. So, here, it is a continuum that goes from preparing to be with others, to being with others, then interacting with others, doing an activity with others, helping and taking care of others, and finally, contributing to society or civic engagement. Now, this is not a linear process. It is iterative. Every phase has an effect on the others, regardless of their level. When we asked which levels of participation were supported by our policy instruments, we answered this. Being, interacting, and helping others are covered by all regions. Just one partner answered that none of the above. Now, being with others is not social participation. So it means that overall, we are just covering 2 out of 4 levels of social participation. Interestingly, partners whose regional operational programs do not address social participation can nevertheless have alternative policy instruments that allow them to address social participation better. This is the case of Louth and Vizcaya that cover all levels of participation and social participation. Now, let's take a closer look into this diagram and keep in mind these red arrows. Okay, first red arrow, doing an activity with others. Let's talk about the active aging index and older people. Now, this definition from their leaflet, hear me out. The Active Aging Index is a tool to measure the untapped potential of older people for active and healthy aging across countries. It measures the level to which older people live independent lives, participate in paid employment and social activities, and their capacity to age actively. But when this index measures participation in society, they take into account voluntary activities, care to children and grandchildren, which from my perspective is quite controversial, care to infirm and disabled, and political participation. So, okay, it could be said that doing an activity with others, which includes sports or leisure activities, is overlooked in the Active Aging Index. So there is a risk of older people seen as a care provider or volunteer, not as someone who needs to have fun and interact with others. And here's a question. Are we missing a key ingredient that could contribute to silver economy? For example, in Louth County Council, we have the age-friendly champion for our businesses. Could that be replicated? Could that be an ingredient that we're missing so that we foster a silver economy? Now, second red arrow, we should address transportation. When we were asked if, according to the needs of older people, we all agreed that regional operational programs should be broadened, but I question, should they? We will talk about that later on. Now, the thematic objectives that all of us considered very relevant were, one, promoting social inclusion, combating poverty and discrimination, but we can say that we are a little bit biased there because we all have kind of the same agenda. But the most interesting for me was that we all agreed that promoting sustainable transport and removing bottlenecks in key network infrastructures was very relevant. Mobility is an instrumental activity of daily living, and as we said in our collective response to the EU Green Paper on Aging, is a basic component to fight isolation. So I think that we all agree that a lot of attention should go here to this almost invisible transportation icon. Now, we also said that investing in education, training, and vocational training for skills and lifelong learning was very relevant. So this got 5 out of 6 very relevant measurements. Number 2, let's talk about volunteerism landscape. Our volunteerism is formal in all regions. However, for social participation, the landscape is a little bit different. Partners with ROPs that address social participation do not rely on volunteers. On the contrary, partners whose ROPs do not address social participation rely heavily on volunteerism for social participation practices. This is the case of Louth and Vizcaya that also have alternative policy instruments that address social participation in a highly effective and better way. When it comes to our national volunteer strategies, half of us said we didn't know if we had one in place. So there seems to be not enough awareness, but could it be that it is because of their lack of impact? Because it looks like having a national volunteer strategy does not have to do with covering volunteer costs, seen as lifelong learning, or contribute to social credits. So there are opportunities there. However, it seems like it does have to do with data gathering or record keeping, because the partners that said yes, they record data, and the partners that say, I don't know, they do not record data. When data is recorded, partners have an access point, and the case studies here are Louth and Slovenia. On the volunteer access points in Slovenia and Louth, the volunteer has access to their information and can utilize their volunteer record. Also, Slovenia is the one with the most complete volunteer record keeping. It records volunteer activities, quantifies efforts in hours, and allows them to apply for further opportunities. Costs are handled differently across regions. The reason for this is unclear. Mostly transportation is covered. Now the case study here is in Slovenia. Maybe this is why they keep such a good track of volunteer activities. They answer this about their scheme. Usually, they get paid for travel and food allowance, but they have appointed number of hours, how many one volunteer can work per month. And if they exceed those hours and work more, they can be paid for that, student work, etc. This discussion came up in our response to the EU Green Paper on Aging Submission as an idea that should be considered. In some cases, volunteerism is seen as positive for job or higher education applications or as part of a community services education curriculum, benefits that are commonly linked to younger cohorts. It looks like all the tangible benefits of volunteerism right now are aimed at the younger generations, and that there are few benefits for older volunteers. Could it be that part of the reason why older people volunteer is for social connection or leisure, and to help, of course? If so, we are talking about unused human resources. We have people that are eager to contribute to society and that are experts in soft skills. Number 3, we're barely there. Good practices and funding mechanisms. We were super curious, so we also wanted to know how we are funding our good practices. So it turns out we have policy instruments that enable social participation. However, in most cases, they are not directly funding our named good practices. We also found that our funding comes from different sources: local authority, charity, private sector, but the most interesting are the ones that are not directly funded. Sources as own funds, other social participation practices, and fundraising. So keep these last 3 in mind. Finally, we asked if our social participation good practice were linked to our national or regional risk-free strategy. However, the only one good practice that was linked to the risk-free was self-funded and reported not being supported by policy instruments. So, question to the audience: what is the role of risk-free for social participation? Now, let's get to our discussion and final thoughts. According to these results, we have to question ourselves: which way to go to influence policy? What do we want to achieve? Restructured volunteerism? Benefits for older people? Or more funds for social participation and good practices? Here is just an idea. Our funding entities have economic resources that they measure and keep track of. They invest those economic resources on areas that offer return of investment to stimulate their economy. When these entities donate resources for social practices, they know there is a return of investment, but not in the same currency. So we need to make an extra effort for them to understand the value. Now, Vizcaya, Coimbra, and Louth funded their social participation practices with own funds and or other social participation initiatives. How did they manage to be sustainable? They achieved a self-sustaining social participation good practice. I think this is the way to go. To achieve whatever we want to achieve based on our analysis, here are some options. The first one is talk in their own terms. What I mean by this is that evidence-based policy responds to quantitative data. So we have to invest in measuring quantitatively to communicate our social return of investments, to ask for more resources, support, or funds. The case study here is the National Toms measurement framework developed in the UK that basically says that every euro we gave to volunteer, it goes to health, services, safety, etc., but it talks in terms of money. If we're going to do this, then likely ROPs are not the way to go. and we will have to focus on alternative policy instruments. Now, the second option is to build our own path. This includes social innovation by creating our own, let's say, risk tree for volunteering. It will imply to morph into social enterprises, and here the case study is Drogheda and District Support for Older People that is developed by Louth, and internationally Sistema B in Latin America, which is a whole consortium of social enterprises that achieve the common good, and they are financed by their own resources. Now here, does the answer lie on the restructuring of our volunteer strategies and benefits to older people? Do we ask for tools for enabling leisure social participation to develop a silver economy? And what about changing the active aging index? That was it. Thank you for your time and attention. I would love to hear from you. So there is my LinkedIn and email address, and please let me know if you have questions.
Thank you, Claudia. And we're going to move on to our next presentation. But before we do that, I just want to read some comments that have been coming in here. And I'm told that the chat function is actually disabled for those of you who are logged on this morning, but you can ask questions through the question and answer function. And so from Rod Bond, really insightful presentations and discussion, and wonderful to see Louth and Ireland so central to driving really inclusive digital participation to underpin evolving age-friendly environments and communities, and well done to all involved. And we are talking about Zoom and trying to navigate Zoom, and the Lifelong Learning Group U3A has actually put in YouTube videos, links to YouTube videos from Brendan Mullen, how to install and use Zoom on an iPad and how to install and use Zoom on a Windows computer. So if anyone wants to copy and paste those links, I'm sure people would find them extremely helpful, so thanks for that, Brendan. Just also to remind you that there will be another EU CHAFE meeting on the 15th of June, and it will focus on the role of new technologies in keeping older people at work and in good health. So we'll have more details of that before we finish up today. I can't believe the technology is staying with us. So far, so good. I just hope I haven't jinxed it at this stage. As I said, we have another presentation now, and it's from Conal McGettigan, a senior executive planner with the Northern and Western Regional Assembly. And he's looking at the future of the regional operational programmes in Ireland. And I think he's going to share his screen with us. So Conal, you're very welcome along this morning. And I'll turn off my video now and let you begin.
Thank you, Sinead. Can you see that?
We can see it. Well, I can, yeah.
So thought I might need an age-friendly Zoom crash course, but hopefully not. So good morning, everybody. I'm here to talk about the future of the Regional Operations Programme in Ireland. But before I do that, I just want to give a background to people on the regional policy framework and the future priorities across Ireland and across our regions and within our counties. And I appreciate that for some people who are European on this webinar, that there may be a bit of an unknown quantity in this, but I'll try and keep it as brief as I can. So I work for the Northern and Western Regional Assembly, and we are, I suppose, the layer of local government. We're a layer of government at a regional level between local government and government departments. So there are 3 regions in Ireland. In green there we have the Eastern and Midlands. In blue we have the Northern and Western, who are the body I'm employed by, and then in the red we have the Southern region. And the second graphic down there is the planning hierarchy in Ireland. So you have at the top the national planning framework, and then you have your regional strategies, and they feed down into strategies at a county and city or town level. So what does the Regional Assembly do? Well, we are involved in creating regional economic and spatial plans. We are involved in being the vehicle through which EU funding is directed, and we're also, I suppose, what we would say is what we would call a platform for collaboration. So we work with a whole lot of stakeholders in our region and beyond, really, whether it's the Western Development Commission or other state bodies, third level institutions, all of our local authorities. So recently we have a joint economist who's employed by the 3 regional assemblies, I should say, and recently we've done a number of pieces of research. 2 years ago, we published a region in transition, which highlights inequality in the way that central government administers funding to the regions, and it shows our region up as the poor relation. It's available on our website. We also more recently published a document called COVID-19 Regional Economic Analysis, and we have also a regional spatial and economic strategy, which has a hierarchy for the county councils or the local authorities within our region. So on the COVID regional analysis, this is just a sample of some of the work that's contained within it. What you're looking at there is a map of the eastern region from Louth down to Offaly, and includes all of the greater Dublin area, Wicklow, Meath and so on. And it is an estimate of the number of private sector workers who are capable of now operating remotely, something which has been accelerated from the pandemic. And it also gives an analysis of the number of digital hubs within each county. So I suppose it's showing up gaps and it's showing up strengths, and you can see there that there's nothing in Longford at the present time, but this was submitted to government as part of the COVID economic recovery plan, and we hope that it'll enable future investment where there are gaps. So when you're talking about an economic strategy for a region as large as our own, the only way you can do that is divide the region into sub-regions. So an example there would be Cavan and Monaghan, which is influenced by Louth, by Dundalk, by Drogheda, right down into Dublin, in the case of South Cavan and South Monaghan. And you have other sub-regions like Donegal into Derry, Sligo, Mayo, the Athlone catchment, which extends into a large part of Roscommon and into parts of Leitrim. And then you have the Galway City and Galway County catchment, which goes down as far as the Galway, Shannon, Limerick corridor, and that's really how you do a regional strategy, is to divide it into sub-regions. And below that, then we've referenced the sectors of growth that we have emphasized in our regional strategy. So we have a number of key pillars in our regional strategy, and one of those is that we want to be recognized as a natural region and to address our sustainable energy requirements. I'll go on to talk about this in a little bit more detail shortly, but we think that there's a need for maybe greater coordination and new thinking across county boundaries, and we have a number of RPOs, or regional policy objectives, around that within our RSES. That's just our planning hierarchy. You have Galway, which is a recognised city and has a metropolitan area strategic plan, which maps out how it's going to grow under Ireland 2040. And within our RSES, then we emphasise the detail around how that is to be done. And similarly with Sligo, Athlone and Letterkenny are regional growth centres in the same way that Drogheda and Dundalk are. So how is this going to be implemented? I suppose there are a number of structures which are aimed at driving implementation over the next 10 years. We already have an Ireland Project 2040 board. We have the RRDF and the URDF, which are government funds aimed at boosting regeneration and projects at a local level. We have an RSES implementation group, which our local authorities feed into, and other state bodies such as the ADA and so on. And then we have county and city development plans, which are in the main being reviewed at the present, and we have an oversight role there. And then there are other plans that are in various stages of creation. You have the marine planning framework, which will be coming out later this year. And recently there was a draft of NIFTA, which is the National Investment Framework for Transport, and also the climate action plans, which were mentioned already today. So you have a very, I suppose, intricate web of plans, and this feeds into funding models, and I'm just going to go on to talk about that. That's a slide on regional enterprise plans, and I suppose they're pertinent when we come to talking about the OP and European funding. Really what these enterprise plans that are going to be mapped out in the next couple of years will do is create funding models to attract industry and to look at how European funding streams can be accessed. So if we look at the operational programme, from 2014 to 2020, there were 11 pillars there over 3 separate areas: research and innovation, competitiveness of SMEs and low carbon economy. And then in the green pillar, you had climate change, environment, resource and efficiency, and sustainable transport. And then on the people side of things, you had employment and mobility, social inclusion, lifelong learning and better education, and better public administration. I suppose one of the more better known schemes that would have come out of that program would be the SEAI Better Energy Warmer Homes scheme. That's just one that almost everybody, the person on the street, would have an idea of and how it works. A scheme that would have derived from the previous program in our own region would be through Galway Mayo IT. It's called New Frontiers, and it was a fund for startup businesses and startup enterprises. I suppose it's worth remembering that when you look at that league table there, Ireland still has a very strong ratio of startups at a European level. And even during the pandemic, our startup figures have remained very strong. When we're talking about those type of programs, and one of the things that's going to be very important that we would see for our own region in the next number of years is the emergence of the CAU, the Connacht Ulster Alliance, which will bring a number of institutes of technology under one umbrella as a technological university, and you'll have 4 campuses. Our region only has 1 university at present, and that's part of our difficulty, and that's in Galway, and that has created a pharma cluster, and we want to replicate that possibly in another way across Donegal, Sligo, Mayo and Galway. So now I'm going to go on and talk about the new OP and just maybe the draft, the high level outline of the programme, just to remind people that there are T&Cs with the funding, and in our own region, we've moved back. The Northern and Western region has moved back from classified as an advanced region to a region in transition because our GDP hasn't performed as well as hoped. We don't seem to be able to attract or secure high value jobs, and that's really one of the main reasons why. So in our own region, where the member state invests €1, they get 65% back. And in the other 2 regions, which are the East Midlands and the South, because they are advanced, where they invest €1, they get 45% of that back. So the OP priorities from 21 to 27. I showed you a slide a minute ago with the 11 pillars. That's now been simplified and it's consolidated to 5. So we're looking at a smarter Europe, a greener low carbon Europe, a more connected Europe, a more social Europe, including the European Pillar of Social Rights, and a Europe which is closer to its citizens. On the smarter Europe, we have a number of objectives: enhancing research and innovation, reaping the benefit of digitization for citizens, which we talked about this morning, enhancing growth and competitiveness of SMEs, and job creation in SMEs, which I've touched on, and developing skills for smart specialization. So one of the areas that we focused on in our regional strategy was the smart region and the idea in the new Leipzig Charter, which I'll go on to talk about shortly. And there's already a policy focus, I suppose, at national level on smart regions. And Leitrim County Council has led out in a project called Smart Villages. There's also detail on that in our regional strategy. And the idea there is that small communities or small towns or villages use digital technology to act as a lever, making villages more agile and better able to utilize resources. And again, it's that type of idea that's reflected in the government's most recent policy, I suppose, tool for the coming 10 years, and that's Ireland's Rural Future, which was launched recently by Minister Heather Humphreys. To further say on smart regions, this idea of people-focused schemes, there are examples around already under the previous round of funding. The Letterkenny Enterprise Centre is one, and there was also that was funded under the Designated Urban Grant Scheme, or the DUGS, and Dundalk also had a designated urban grant scheme that was very successful, and it resulted in further regeneration following on Clanbrassil Street in Dundalk, as I understand it. So they're just recent examples, and that's the example on the Letterkenny side. You have a county council offices there on the right hand side, and a regeneration schematic there on the left for a number of buildings, including the social enterprise building there in the centre, which is DUGS funded. So if we move on to talk about our Greener Europe, there are a number of high-level objectives: promoting energy efficiency, renewable energy, smart energy systems, including grid and storage at a local level, promoting climate change adaptation, sustainable water management, and so on. So when we talk about sustainable water management and a Greener Europe, one example that I'd like to give you this morning is that there's a current program called Catchment Care, and it's been funded under the Interreg VA program. It concerns 3 river catchments, as you can see them there outlined in blue on the map, and they're all cross-border, and they're all very intensively agriculturally worked, and they've all had difficulties with water quality in those catchments over the last number of decades. And what this project aims to do is to improve water quality across the board. And the picture on the right hand side there is new planting along a riverbank to act as a buffer zone. This is the type of measure that this project, I suppose, aims to replicate across the 3 river catchments. So you have multiple partners involved in this type of program. In this particular program, local authorities north and south, you have significant community engagement, you have stakeholder events, you have engagement with farmers, people who own land within these catchments, schools awareness programs, and community incentive schemes. So there are 43 voluntary groups across those 3 river catchments that have all been funded. Some of them have been funded up to €25,000. I should have said there at the outset that the project value is over €14 million. And one of the examples here is the FANAP, or anti-pollution project. So it's a citizen science group, and it's funded and trained to monitor water quality themselves, and they're given the expertise and the equipment to do this. And when you look at this example and you look at the EPA's recent report on the state of the environment in Ireland 2020, the indicators aren't good, and our water quality, soil health, and climate measurements are not favourable, and they're deteriorating across a number of areas. And we would see that this type of environmental improvement project will be replicated in the coming decade, and will be an example that you may see again in a different form or a similar form across the new OP. Urban regeneration is the other pillar that I'm going to talk about this morning, or a Europe close to its citizens, and there's a number of high-level objectives here also. Enhancing digital connectivity, which was talked about in detail this morning. Sustainable, climate resilient, intermodal 10T network. That's around connectivity, and it's around how people get around, both locally and regionally, and across the European Union, and promoting sustainable multimodal mobility. But I suppose for us in our region, one of the things that we can say is that while the OP won't be funding capital projects on road or rail, we do have an ambition to achieve a greater modal shift in getting people onto public transport. And we want to see increased investment in sustainable travel, and the government are moving that way. And we've seen it recently with significant investment in sustainable urban transport and moving away from private vehicle dominance. And recently, there was a consultation on the 10T core and comprehensive review as part of addressing this change or mode away. So what we have in our region, it's not so much for Louth, but in the top left there, you can see a great geographical disparity in terms of infrastructure provision across the island of Ireland. And that is something that we are saying will need to be fixed before you can achieve modal shift, because you have to have reliability and you have to have certainty on journey times. And in parts of our region, we don't currently have that. One of the things we've also asked that would be examined in the regional strategy was that as a result of Brexit, that map there is the 10T map. So your ports, your rail and your key road links that are on the European 10T. And the port side of things, we have Belfast, we have Dublin, we have Rosslare Europort there, and we have Cork and we have Foynes. But beyond Foynes and right around to Belfast, we don't have anything that's above a tier 3 port. And we have Killybegs and an upgrade to Galway port, and they should be investigated maybe as potentially being included in the 10T network going forward. So I did mention the new Leipzig Charter earlier on, and that is a 13-page blueprint that was launched last year by the European Union on sustainable urban development. And it's important to say that they're looking at sustainable transport and public realm enhancements. And I think Ireland 2040 has already started this country and heading down that road. And the idea of compact growth, for those who don't know, it's within Ireland 2040 that the notion of compact growth means that between 40 and 50% of new development will occur within the existing built up footprint of towns and cities, so that you're not expanding and building new houses or new industrial development outside of an existing footprint or in a green belt zone. And it means that everything is more compact and more easily serviced. So what we're planning for over the next 10 to 12 years in the regional strategy and in Ireland 2040, and the European funding feeds into this, is that hopefully we'll have a post-COVID recovery, and the population across the country will continue to grow as it has been doing, and we'll see a jobs recovery, and that there would be continued investment in our urban centres and in sustainable travel, as well as smart technology over the next 10 years. Finally, when we're talking about the OP, there are a multitude of funding streams out there for local authorities and others to pursue, and I suppose part of the challenge is knowing where the funding is and how to go after it as much as anything else. So you have the Rural Regeneration Development Fund and the Urban, which are both under Ireland 2040. You have EU funding, you have climate action funding, and a whole number of others. And it's worth also remembering that in the last 7 years, European structural investment funds have ploughed 3.4 billion into Ireland, and although it has reduced over the last number of decades, it's still very significant, and it's a significant sum. So I'm just going to conclude, Sinead, by saying that we have multitude of funding structures, including the OP, and we're all of these funds are really attempting to travel in the same direction, and they're committed to the themes and the principles outlined. And that's greener, smarter, and more urban regeneration and targeted improvements in connectivity. And although that's a very headline presentation, I hope I've maybe given a coverage to the whole, to all. Thanks.
Great, Conal, thanks for that. I know there is some questions here on the Q&A, but unfortunately we're up against time. So we might try and link up with Conal again and get him to answer some of those questions. But now it's time to take a look at some of the projects and initiatives being run by our EU SHAFE partners. We'll see videos from Spain, Portugal, Germany, Denmark and Slovenia.
Teenagers and people with disabilities map their surroundings, sharing their results in OpenStreetMap and make suggestions for improvement, writing an accessibility report. What we do? First of all, we begin in the classroom. All together, take part in a workshop of universal rights and social inclusion. Then there are a briefing indoor with instructions for everyone for the firework, and then with mixed groups, teenagers and people with mobility difficulties, the volunteers, the experts by experience, walk around the city together. They look at points of difficult access, alternative routes, using a piece of paper with the map, the field papers. These field papers, full of data, with this one, they map these points, they upload these points on OpenStreetMap, and using this free software, they edit these digital maps and use a traffic light color code for each one, for then have the friendly routes. And with all the data, how we help them to analyze it? We need interdisciplinarity on different fields, on research, on different experts by experience from the community, and on different topics, different academic subjects. Combining citizen science, people making science and taking part in all the cycle in this stream way. Combining this stream citizen science with a waterfall model in service learning methodology. Then we, in fact, they help to promote inclusion, empowerment, and real engagement. Finally, as part of all the process, the students submit accessibility reports to public administrations and to their community. And of course, there are a final evaluation to recognize everyone's efforts and taking responsibility.
This was a short video about the Idovich projects. The Idovich project, Older Persons That Visit Other Older Persons, is a project that was conceived and implemented in Caritas Coimbra, and that emerged from the different needs of two types of older persons. This project didn't have any type of financing, but it had the very active participation of stakeholders who supported its implementation. On one hand, we have older adults who still have a lot of energy, mobility, and a desire to feel useful. On the other hand, we have older persons who are much more dependent, some of them confined to bed with chronic diseases or dementia and many limitations, and who often do not receive enough visits. They are a long time alone and are not able to carry out activities. The Idovich project was launched in 2016 with the aim of creating groups of independent older adults who were visiting dependent people in long-term care, nursing homes, and home care services after adequate training for this purpose. The main objectives of the Dovish project were to improve the emotional and affective state of older people in situation of dependency, to create support networks between dependents and independent people, to increase the activity, sense of usefulness, relational capacity, and knowledge of older adults, promoting volunteer among peers, to increase tools to support the monitoring of older people in a situation of dependency. Through partnerships with our stakeholders, teachers and nurses trained the group of visitors. They were in authentic classrooms with very attentive students that learned the best techniques to visit their persons. They learned how to speak, how to knock on the door, what activities to do, how to grab the hands, how to get close to the people they were about to visit. During the project, the routine was established. They visit the person who was assigned to them weekly. And then we evaluated the impact of visits on the quality of life of both groups of older people.
The new Altona Center is a new center for everyone. This is a residential district where many things are being thought of and done differently. For example, this district was designed to be as inclusive as possible, because society is growing ever more wonderfully diverse, while also changing and growing older. Today, I'm visiting Nadine Schindel in her own flat. She's a young woman who, until recently, still lived in a care home. Living in a flat without roommates at the age of 24 is something many of that age would like. For Nadine Schindel, it is a small miracle. Until recently, the young woman has spent most of her life in care homes. She has been living in the new center for over a year now, independently and self-sufficiently.
Before this, I lived in a wide variety of institutions where I had to follow a strict timetable, even for going to the toilet. That's why, for me, it's not just about the option of having my own flat. It's also about having more freedom. Just being able to go to the toilet, to take a shower whenever I want to, and not when someone allows me to. And of course, being able to come and go in and out of this flat, to meet my friends whenever I want, when we've planned to, not when someone has time to put me in bed afterwards.
What in this flat had to be changed for you?
Well, the ceiling hoist definitely had to be installed. And then I also had to bring various other aids here with me. The home care bed, for example, and the shower chair. What is very important, something you don't even think about that way, is of course the wheelchair. I consider myself very lucky to always have very sympathetic contact people, both with the authorities and with the health insurance office. From that perspective, it's great that so many people are deciding again and again to take action, to do their part so that this dream can continue to be a reality.
Moving into her own four walls would hardly have been possible without outside help. For example, there's Steffen Sauthoff, who supports people like Nadine Schindel to the best of his ability as a community living assistant. Our main focus is to enable people with support needs to be self-sufficient, to enable them to take a lot of things that they can do for themselves and really take charge of them as well, to exercise their power. I sorted things together with her, but she made all the phone calls and made it possible herself. I acted as a moderator, in the background to a degree, always trying to work out the priorities with her again, to plan the next steps. But Mrs. Schindel handled the actual practicalities of what had to be done herself. Since the community living assistant model has been so successful in helping people with disabilities, the Alsterdorf Protestant Foundation is now making it the rule. If someone approaches the West or East Alsterdorf assistance institutions, A community living assistant will be there to help them out. This approach is also being transferred to elder care in the district of Hamburg North, in the new model project Q plus Alter.
It's important for us.
Jeg var lige flyttet til Langenæs, og jeg kendte slet ikke området.
Jeg flytter familien fra Aarhus Midtby til Mårslet.
Jeg var netop blevet færdig med at renovere på vores hus.
Og så står jeg og skal falde til og lære en ny by at kende. Jeg får lyst til at starte noget op sammen med nogle andre herude.
Så jeg gik og tænkte på, om der var et sted, hvor jeg kunne finde et fællesskab.
I dag er der en, der laver et opslag på Facebook, om der er et sted, hvor man kan lære at strikke eller hækle. Og så kan jeg se, at det vil faktisk være ret enkelt at starte noget op.
Så jeg hiver fat i en frivillig konsulent, og han foreslår mig, at jeg kan servere til fællesspisningen.
Og så kom jeg herover i værkstedet for at lave nogle ting, jeg ikke kunne lave derhjemme. Og så blev jeg jo hængende.
Jeg er svagsynet, så første gang er jeg vildt nervøs. Nu har jeg lavet mit eget system, og jeg har endnu ikke væltet et glas.
Bente, hun lærer mig at lave vrangmasker, og jeg lærer hende at bruge Pinterest.
Det kan ske, vi er 2 til kaffepausen, så tager den ikke så lang tid. Men det kan ske, at vi er 5, og så kan den jo tage op til 3 kvarter.
Det giver en følelse af at høre til sit lokalområde. Det der med at kunne hilse på nogen i Brugsen.
Det betyder noget for mig, at jeg er tilknyttet et sted. Her føler jeg mig hjemme.
Vi har snakket om, at vi måske også skal lave vinsmagning. Det er sjovt at se, hvad det kan udvikle sig til.
No daj zamigaj, migaj, migaj z nami. Je polka zdrava, generacija smo prava. Življenje teče, mi pa si aktivni. Stari mladi skupaj migamo. Je že res, da mladost je norost. Ves predan, rad grem srcem novi dan. Saj v življenju je lepo. Skupaj se poženemo v akcijo. No daj zamigaj, migaj, migaj z nami. Je polka zdrava, generacija smo prava. Življenje teče, mi pa vsi aktivni. Stari mladi skupaj migamo. Je že res, da mladost je norost. Ves predan, rad grem srcem novi dan. Nasmejan, saj v življenju je lepo. Skupaj se poženemo v akcijo. No daj zamigaj, migaj, migaj z nami. Je polka zdrava, generacija smo prava. Življenje teče, mi pa vsi aktivni. Stari mladi skupaj migamo. No daj zamigaj, migaj, migaj z nami. Je polka zdrava, generacija smo prava. Življenje teče, mi pa vsi aktivni. Stari mladi skupaj migamo. Življenje teče, mi pa vsi aktivni. Stari mladi skupaj migamo.
Now, if you were all here, I think we'd all be dancing around the room after that. But look, more great videos and a wonderful insight into what is happening and what is being run by our EU Shafe partners. We're coming towards the end of this morning's session. I'd like to thank you all for your company. And if I could ask the panelists and contributors to turn on their cameras if they wouldn't mind, just while we wrap up. I'd like to thank a few people, Federica in the ECH Alliance and her team. Thank you for making all of this happen. It just doesn't happen that easily. A lot of time and effort and work went into making this be so flawless. Here in Louth, I'd like to thank Mary Deary and Grania Komowski and Anne-Marie for making my job so easy this morning. They did all the work behind the scenes, so thank you very much. We would love to have you here this time, but unfortunately that wasn't to be. But hopefully someday we'll be able to welcome you to County Louth. And just to finish up this morning, I'm just going to pass back over to Joan Martin, CEO of Louth County Council, who will make some closing remarks.
I keep forgetting when I plug in my earphones, I lose my mic. Whatever about Sinead, I was doing a bit of chair dancing with that catchy tune there at the end. So despite our huge disappointment that we couldn't welcome people in person, I still think we've had a marvellous morning, really, really interesting. We've seen a little bit about a huge amount of different projects. We've had some meatier presentations from Claudia, from Connell there about the regional programmes. And all of that is all part of the learning that we need to do. It's not just enough to do the soft stuff. We need to understand the systems and the programmes, and we need to do the research to have, as Claudia said, if you're trying to challenge a policy or a programme, you have to have your quantitative analysis. I took that out of it, at least, Claudia, whatever about all of the other details. So just a huge thank you to you, Sinead, for guiding us through the morning and for being such a wonderful moderator, I have to say. And a huge thank you to all of those who gave up their time this morning to come and speak and to come and listen and to come and join. I really hope that you enjoyed it as much as I did. I hope that, like myself, you've taken all kinds of ideas and inspiration away from it. And I hope we'll have many more days like this, and that it will motivate and inspire all of us to continue our dedication to age-friendly futures, and to continue all our great work that all of us are doing every day. So a big thanks and a big love from Louth and from Ireland. And we wish you were all here, but you're not. So we send you our love and our greetings.
Thanks, Joan. And just to remind everyone that the next EU SHAFE meeting takes place on the 15th of June. It'll focus on the role of new technologies in keeping older people at work and in good health. So that's it from this morning. I know there was a few people asking about a recording of this session, and there will be a recording available. And of course, if you have any questions or anything you'd like to ask, or anything about any of the information you saw here today, you can make contact with the organisers and we'll be able to pass that information on. So from myself and from everyone here in Louth County Council, thank you so much for your patience, for your commitment, for your insightful contributions, and thankfully technology stayed with us throughout. So listen, mind yourselves, stay safe, and hopefully we'll see you all again soon. Thank you.